If you've got knee pain, or know someone who does, you've definitely heard it called wear and tear, right? But what if I told you that's not even half the story? Today, we're diving into a new way of thinking about knee osteoarthritis, seeing it not as a simple breakdown, but as a complex condition that you can actually get a handle on. So let's just ask it right out of the gate. Is that nagging knee pain really just your cartilage wearing thin? The short answer? Nope. That phrase wear and tear just really oversimplifies what's actually going on inside your body. And hey, that's not just my opinion. This comes straight from Dr. Costa, a pain specialist physiotherapist whose guide is the foundation for everything we're talking about today. He's super clear. If we want real relief, we've got to look way beyond the joint itself. So that's our first big step. We're going to completely rethink what's causing that pain. It's time to zoom out from that one sore spot and look at the whole system. Because it turns out, your knee is definitely not working in isolation. Just look at how connected all this is. Knee pain isn't just a mechanical problem. It's tied to things like inflammation all over your body, what you eat, your stress levels, and, huge one here, how well you sleep. And that last point, an oversensitive nervous system, that one's a real game changer. So this idea has a name. It's called central sensitization. And here's the best way to think about it. Imagine a car alarm that's just way too sensitive. You know, the kind where a leaf lands on the hood and the thing just starts blaring. Well, your nervous system can get like that. Its volume gets turned way up, making pain signals feel much bigger. The pain is 100% real, but it might not match the actual amount of damage in the joint. It's the alarm system that's overreacting. And that leads to the most important part of all this. Here's the good news. You can't change your genetics, you can't undo an old injury, I get that. But you absolutely can influence your lifestyle, your sleep, your food, and even how wound up your nervous system is. And that is where your power is. Okay, so let's build on that feeling of empowerment. Let's get practical. We're about to open up a daily relief toolkit filled with simple, everyday changes that can make a surprisingly huge difference in your pain. First up, sleep. And I mean it. This is a non-negotiable. Dr. Costa calls it one of your body's most powerful recovery tools. See, when you sleep poorly, you're not just tired. Your body actually ramps up inflammation and turns up the volume on that pain sensitivity we just talked about. So getting good sleep isn't just about feeling rested, it's an active pain management strategy. Next, something so simple, hydration. Your cartilage is kind of like a sponge, right? It needs water to stay healthy and cushion your joints. So here's a solid number to shoot for. About 30 to 35 milliliters of water for every kilogram you weigh. Just sip it throughout the day. It's such a basic but powerful habit for your joints. And of course, there's food. The goal here is simple. Calm down inflammation. So on the left, you've got the usual suspects that tend to stir things up. And on the right, you've got the anti-inflammatory all-stars, like fatty fish, olive oil, and all those colorful berries and leafy greens. It's all about tipping the scales in your favor. Okay, so we've talked about sleep, water, and food. Now let's get into the physical side of things, how to move smarter, and how to give your body the support it actually needs. Now, moving smarter doesn't mean stopping. It's about managing your energy. This is called pacing. And the key idea is to learn your body's signals and stop just before you think the pain is going to flare up. That way you stay active without getting into that frustrating cycle of doing too much, crashing, and then having to rest for days. And please, don't forget your foundation, your feet. Good shoes are like shock absorbers for your entire leg. A little cushioning and some stable support can take a surprising amount of pressure off your knee with every single step you take. It's a simple fix that works for you all day long. Okay, so what about actual exercises? Dr. Costa's guide lays out this fantastic progressive 6-week plan, and its real genius is how it's structured. You don't just jump in. For the first couple of weeks, you're just gently waking up the muscles around the knee. Then you start building strength for real-life movements, like getting out of a chair. And finally, you work on control and stability so you can really start to trust your knee again. It's a safe, gradual way to build a stronger, more resilient knee. All right, our last strategy is something you probably aren't expecting. It's a natural remedy, it's backed by some evidence, and, well, you might just have it in your fridge right now. Yep, cabbage leaves. And I know, it sounds like an old folktale, but some clinical research has actually shown that cabbage leaf wraps can help reduce pain and swelling for people with knee osteoarthritis. The compounds in the leaves seem to have some mild anti-inflammatory effects. Look, it's simple, it's cheap, and it's definitely an easy thing to try, especially when your knee is really flaring up. So let's bring it all home. The biggest, most important message here is about empowerment. A diagnosis of osteoarthritis does not have to be a sentence to a life of pain and decline. As we've just seen, you have a whole toolkit full of strategies you can use to take back control and get back to living your life. So I'm going to leave you with this question. Don't try to do everything at once. Just looking at this whole toolkit. Better sleep, smarter pacing, a simple food swap, maybe even trying that cabbage leaf thing. What's the one first small change you're going to make today? Everything we've covered in this explainer was based on the fantastic patient guide from Dr. Costa, a pain specialist physiotherapist. It's just a great reminder that truly understanding the complexity of your pain is the first and most powerful step you can take.